Hi, I'm Garvin. This video is on Desmotabs. So what are Desmotabs used for? They're used for treating a disease called cranial diabetes insipidus, in which large amounts of dilute urine are produced, resulting in constant thirst. It's also used for treating increased intense thirst and production of large volumes of dilute urine following surgical removal or destruction of the pituitary gland, or post-hypocectomy polydipsia and polyuria. So how does it work? The Desmotabs tablets and Melt tablets both contain the active ingredient Desmopressin, which is a type of medicine called a vasopressin analogue. It is similar to a hormone produced naturally by the body called vasopressin, or antidiuretic hormone. The antidiuretic hormone, ADH, is produced by the pituitary gland in the brain. It is involved in controlling the natural balance of water levels in the body. It normally acts on receptors in the kidneys to prevent excessive amounts of water being filtered out of the blood and into the urine. This reduces the production of urine. So Desmotabs is similar in structure to this hormone and works by mimicking its action. In the condition diabetes insipidus, the kidneys produce excessive quantities of very dilute but otherwise normal urine. This causes excessive thirst and can lead to dehydration. Diabetes insipidus can be caused by a problem with the kidneys themselves, nephrogenic diabetes insipidus, or by a deficiency in the production of ADH by the pituitary gland, which is cranial diabetes insipidus. Desmotabs is used to treat this latter rare form of diabetes, which should not be confused with diabetes mellitus, also known as sugar diabetes. If the pituitary gland is surgically removed, this will also result in the deficiency in production of ADH and similar symptoms of excessive urination and thirst. Desmotabs work by binding to ADH receptors in the kidneys, which mimics the effect of natural ADH. This reduces the production of urine and, as a result, improves thirst. Desmotabs are standard tablets, and the Desmomelt tabs are designed to be placed under the tongue where they will dissolve in the saliva without the need for a drink. They're to be used in caution in decreased kidney function, decrease or disease involving the heart and blood vessels with cardiovascular disease, also in cystic fibrosis and high blood pressure or hypertension. Also used in caution where imbalance of water and salt concentrations in the blood, fluid electrolyte imbalance, and people at risk of developing raised pressure inside the skull, intracranial pressure. It is not to be used in heart failure, other conditions treated with medicines that increase urine production or diuretics. Also abnormal intense thirst caused by mental disorders, psychogenic polydipsia, and people who drink abnormally large amounts of fluid, including alcohol. This medicine should not be used if you are allergic to one or any of its ingredients. Please inform your doctor or pharmacist if you have previously experienced such an allergy. If you feel you have experienced an allergic reaction, stop using the medicine and inform your doctor or pharmacist immediately. For pregnancy and breastfeeding, this medicine should be used with caution during pregnancy and only if the expected benefit is greater than any possible risk to the developing baby. Seek medical advice from your doctor if you're unsure. If this medicine is used during pregnancy, blood pressure monitoring is recommended due to an increased risk of pre-eclampsia. This medicine may pass into breast milk. Seek medical advice from your doctor if you are breastfeeding. So the side effects will be headache, stomach ache, nausea and vomiting, emotional disturbance in children, and if taken without restricting fluid intake, retention of water in the body tissues, fluid retention, low blood sodium level or hyponatremia, or seizures or convulsions. The side effects that I've just mentioned may not include all the side effects reported by the drug's manufacturer. For more information about any other possible risks associated with Desmotabs, please read the information leaflet provided with the medicine. So how can this medicine affect other medicines? It is important to tell your doctor or pharmacist what medicines you are already taking, including those bought without a prescription and herbal medicines, before you start treatment with this medicine. Similarly, check with your doctor or pharmacist before taking any new medicines while using this one to ensure that the combination is safe. The following medicines may increase the release of natural antidiuretic hormone in the body and may therefore increase the effect of Desmotabs: carbamazepine, chlorpromazine, non-steroidal anti-inflammatory drugs, for example indomethacin, the SSRI antidepressants such as Prozac, tricyclic antidepressants such as amitriptyline. If you're taking Desmotabs with any of these medicines, you should carefully follow instructions about restricting your fluid intake, because these medicines may increase the risk of fluid retention and decreased concentration of sodium in the blood. Loperamide, used to treat diarrhea, may increase the blood level of Desmotabs taken by mouth. As a result, it may also increase the risk of fluid retention and decrease concentration of sodium in the blood. It should be avoided by people taking Desmotabs tablets. So if you have any questions, you can contact me through the live pharmacist on the website. You can email me or call into Lynch's Pharmacy in Cork. Thank you for watching and have a nice day.